Bismillahirrahmanirrahim. Good afternoon. First of all, I want to show my gratitude to the Oncology Club Bangladesh for inviting me and give the opportunity to present my case. Dear audience, Assalamu alaikum. I am Dr. Rafiqul Islam. Welcome you to all. So, biomarker-driven treatment in oncology, especially in Bangladesh, what are the challenges, availability, cost, reliability, how to overcome? This is my area of talking. So, biomarker-driven treatment nowadays, treatment change the treatment paradigm shift from the more toxic chemotherapy to more targetable and personalized treatment which improves the outcome of the disease in terms of overall survival and progression-free survival. So what is biomarker? Biomarkers are the substances that is releases into the body fluids or blood during tumorigenesis it and which have the encouraging value in the diagnosis, screening, risk stratification and so on. So, the steps of biomarker driven treatment, there is some steps, these are the progressive steps from development of the reliable biomarker test and ultimately the implementation of the targeted therapy. So, this is the timeline of tumor biomarker. First tumor biomarker was discovered in 1847 and in 1918 and 218 EGFR was diagnosed in the liquid biopsy specimen. So, this is the biomarker, organ-based biomarker with overlapping, and this is the action hallmark biomarker, three types of hallmark biomarker: acquired, emerging and enabling biomarker. These are the biomarker that works with the various mechanism like progression, invasion, resist the cell death and causes ultimately metastasis. So, this is the biomarker. So, introduction. The use of biomarker driven practices in cancer treatment in Bangladesh is evolving but still faces several challenges. Global trend in oncology is towards personalized medicine based on genetic and molecular biomarker. The integration of such practice in Bangladesh is still in the early stages, and the following challenges it faces. The use of biomarker driven practice in cancer treatment in Bangladesh is limited healthcare infrastructure facilities, high cost, lack of research data, unavailability of the specific drug, lack of awareness and regulatory and systemic issues and ethical issues. So, a pilot study was done in Bangladesh on biomarker testing by Dr. M.A. Shumon in Kurmitola General Hospital, where 50 oncologists are participated, and they are shown that the cost of the biomarker testing is high in Bangladesh, 96%, and less availability of the labs and lack of availability of tissue is more, respectively 76% and 56%, followed by regarding the interpretation of the result and lack of validation of the report is 34 and 28% respectively. So, changes in biomarker testing in Bangladesh, we have limited high healthcare infrastructure. Though Bangladesh has improving in various sectors, but the healthcare infrastructure is minimum, which affect the susceptibility of medical care for population below the below the key aspect of the limited infrastructure in Bangladesh, I show shortage of healthcare facilities, insufficient medical equipment and technology, shortage of healthcare professionals, inadequate medical education and training, access and affordability, overburdened public healthcare system, and inadequate health policies and regulation, limited specialized oncology care. So this is the article published in Economic Times. Here 33, shows that 33% of the metastatic stage cancer patients discontinue treatment due to their high cost. And the cost is high when especially in the field of targeted therapy, when the patient disease become metastasized. It is in metastatic stage targeted therapy on an average 13.8 lakhs is needed. So what about Bangladesh? The average cost of biomarker testing in various organs is ranging from 15,000 to 70,000. But when the large panel NGS is needed, then the cost is so high, it is 50,000 to 2 lakh. So how healthy is the health budget? I think the health budget is not so sufficient in Bangladesh. So current healthcare expenditure per capita is only 2 to 3%. Current health expenditure per capita, Bangladesh is only $58. Out of pocket expenditure is 77%. And out of pocket expenditure per capita is only $42. So the actual scenario in Bangladesh expenditure in healthcare sector, expenditure on health as a share of GDP was the lowest among the 45 least development countries in 2001 in Bangladesh. Allocation for health in fiscal year 2025, budget is only 5 to 2% of the total budget and 0.74% of the GDP. So in 2021, out of pocket expenditure was 73% of total health expenditure in Bangladesh. So such a low budget on healthcare system produces a vicious cycle and increases in poverty, pushing families further into economic hardship. So how can we overcome? Through research and development, there is increasing interest in molecular and cancer research. Several hospitals and research institutes are beginning to explore and integrate molecular testing for specific cancer, especially in Dhaka. And the National Cancer Control Plan, the government has included cancer as a priority in its health program and established 8 regional cancer centers with some focus on biomarker-driven biomarker facilities. And the public and private health sector is coming forward in this sector. Recently, Bardeb Hospital, a non-government organization, has launched its NGS facilities. So it would, from here, we people will be helpful. So the growing awareness is needed and adoption, National Cancer Control Policy and Planning, and the strategic plan outlines the goal for early detection, improved treatment option and better access to a cure. And incorporation of biomarker, though it is still in the early stage in Bangladesh, but some of the organizations like National Institute of Laboratory Science and referral centers are enabling different biomarkers testing and plan for NGS in future. So the pilot study was done by MS Aziz Shumon. They are participating with the participating oncologists. In 70% of the cases, not interested in biomarker-driven treatment in first setting. So how to overcome the barrier? By increasing funding and investment, develop skilled workforce, availability of the targeted drug, adopt advanced technologies, reduce drug cost and ensure availability, and raise awareness and prevention efforts, improve accessibility of care, equal distribution of resources, and so on. So, sorry. So, why the patient goes to our neighboring country, India, for their treatment? Here, here there is a 100%, approximately 2.5 lakh patient goes to India for their treatment, and 11% travel to India only for their early diagnosis. And cancer patient flees to the go to the neighboring country, ranking the second after the cardiac diseases, and the average consultation time is only 2 minutes, but unfortunately it is same with the Indian doctors. So this is a great team to overcome this barrier. Thank you for listening.
Thank you, Dr. Md Rafiqul Islam, sir, for your presentation of current biomarker-driven practice in Bangladesh. Now, I would like to invite Dr. Mohammad Mustafizur Rahman, Senior Scientist, ICDDRB, Dhaka, to present his talk on what is the scope of standard lab services for biomarker testing. How can ICDDRB contribute?
Good afternoon, everybody. I'm Dr. Mustafizur Rahman. I'm from ICDDRB. I'm the head of Genome Center. So I'll talk about today the scope of laboratory services on cancer biomarkers in Bangladesh. Mainly, I will talk about how ICDDRB can contribute to this biomarker testing. So you know that in human body we have billions of cells, and they die after some time naturally. But some mutations can happen in our cells, which can make these cells continuously grow and also sometimes immortal, and this is the cancer. So we have to know that what changes are there, and these are the biomarkers. These changes can be detected by molecular assay. You know that different types of this type of biomarkers have been already identified in different cancers. And these are the example for different cancer. You have a lot of biomarkers already identified and FDA approved. So these are the driver mutations you can see in these genes. So we have to identify this biomarker by molecular assay, and recently we have the next generation sequencing technology. But you know that there are different types of diagnosis for cancer, like imaging, histopathology, and also some molecular testing. I will just focus on the next gen sequencing for detecting this biomarker today. So why we will do the biomarker testing? Number one is for diagnostic purpose. You have to know that whether you have a cancer or not, present or absent of the cancer. And secondly, what is the stage of the cancer you have? You can also identify the stage of the cancer by detecting different types of biomarker. And finally, for the precision medicine, that means that you give a treatment to a patient and you have to follow him up for the progression of the disease, and whether you need to change the regime of the treatment, you can identify by identifying the biomarker. So this is, you see at the left, normally chemotherapy is used, and if you are not targeted, then all the cells, both the healthy cells and also the targeted cancer cells will be destroyed. But if you have the targeted therapy, then you will only target those cancer cells. So nowadays, targeted therapies are available and FDA approved, and many of the countries, it is mandatory to use this targeted therapy. Because this is more beneficial for the cancer patients. And here you can see the different scenario for the lung cancer. So all of those had lung cancer, but they have different types of mutations in their genes. And for different scenario, you have to use different therapies, therapy A, B, C, D, different therapies. So it is very important to know that which type of biomarker are there for these patients. So there are so many obstacles in Bangladesh, and you can see at left that the sample quality, sequence quality, result interpretation, and the turnover time, and also the cost and reliability. These are the issues, and that's why that most of the tests are samples sent to outside for testing. So in Bangladesh, we have overall, I think, around 15 different NGS setting or facility, but most of them focus on the pathogen genomics or different samples other than cancer or human samples. But now, couple of centers, they are trying to start the cancer biomarker testing at this point, and ICTDRB is one of them. We started our genome center about 10 years ago, but we focused on mainly the pathogens, the bacteria, virus, and other diseases, but not cancer. So last month, we had a very good seminar in our center where many oncologists also attended this seminar, and there was everybody had a consensus that we should start doing this cancer biomarker testing at ICDDRB because we are already equipped with the state-of-art technologies in our center for last 10 years. And the most importantly, we have a very good young and energetic bioinformatics team who can interpret the results. So we are thinking about to launch this cancer diagnostic, and how we can overcome those problems, I will just describe now. So we are going to offer these 4 different panels for cancer, for BRCA, PRO, and HRR panel. These are for the breast cancer and ovarian cancer. And then the classic panel will be for colorectal cancer, lung cancer, and prostate cancer, and then the blood cancer myeloid panel. And we are also going to offer some PCR-based, which is quick and very popular test. We'll offer these. So how can we overcome the challenges that we have already learned from Dr. Rafiq already told us that these are the challenges. So quality assurance is the big challenge for us. So you know that ICDDRB has been doing for diagnostic for a long time, and our labs are already accredited, the ISO accredited labs, and all the equipments, including centrifuge, micro, pipette, everything is calibrated always. So we have also a separate QA or quality assurance unit and also biosafety unit already working, and regularly they monitor our tests. So we don't compromise actually with any quality. And we also regularly participate in the EQ, external EQ panel. So this is how we will assure the quality of our test. And secondly, the timeline. This is very important, and you know that it takes time. When you go for the next-gen sequencing, it takes at least 2 weeks. So we have already worked on that, and we think that we will give you the results by 10 days. And you can see that there are several steps you have to follow for doing these. From the very beginning, you have to extract the DNA, and then you have to evaluate the quality of the DNA and go for library preparation. After that, you have to run in the NGS, and interpretation is very important because you will have a lot of data which should be interpreted by expert bioinformatician. So it also takes time. So we have calculated and we hope to give the report by 10 days. So third is cost. Cost is very important. You have already heard from the previous speaker in Bangladesh. So we also thinking about how we will minimize the cost and reduce the cost. The first thing is that we are going to use different platforms. We have at least 3 platforms. One is MySec, one is NextSec 500, and we are going to have very soon in this year the NextSec 2000. So having these different types of platform, we can leverage this platform for the samples. For example, if you have 100 samples, we will use different cartridge, and if we have 10 samples, then we will use different cartridge. So by this, choosing this different cartridge, we can have minimize the cost. Secondly, we are keep in touch with different reagents provider. So we are talking with them, and we will have the best price from them. Thirdly, you know that ICDDRB is a non-profit organization, so we have nothing to profit. So I think we will manage somehow that we manage the largest diarrheal disease hospital in Bangladesh, where we are treating more than 200,000 patients per year without any cost. So we think that we can manage to reduce the cost for this cancer patient also. We think that it is a service for us, not any profit. So finally, we are planning to give some subsidy for the patients in need recommended by the oncologists and the doctors. So this is the most important part, the results part. So the report is very important, and it is very difficult to understand for the oncologist sometimes and also the doctors. So we have the bioinformatics team always ready to help them discuss the results with them. Any type of discussion and any type of advice we will provide to the oncologists and doctors. So the take-home message is ICD will be ready to launch this biomarker cancer testing, and we have the established lab, and we will deliver by 10 working days the timeline. And then as a ICDDRB is a non-profit organization, we'll ensure the cost effectiveness of the service, and the quality will maintain, and with the strong bioinformatics team for the data interpretation, we'll be ready for you. Thank you very much for listening.